You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how to look years younger by just taking care of the eyes. With us, we have an expert on the topic, board-certified plastic surgeon. She is the go-to person in LA for the aging eye. With us, we have Dr. Lily Lee. Dr. Lee, welcome to the program.
Great to be here, Randy.
Now, I said LA, but I mean, you're in, I guess you have Palm Desert.
Correct.
LA. Where are you located, by the way? And where are the locations?
I'm in Pasadena and Palm Desert, and I do go to Temecula twice a month, actually.
Okay, good. And you are a very busy surgeon. Is that right? When it comes to eyes.
It keeps me out of trouble.
I mean, you do up to 15, 16 eye surgeries a week.
We do.
That's more than most guys do in like 6 months.
I'm very fortunate to be married to an ophthalmologist who is...
So that's how you're getting the referrals. Your husband.
Yes, we try to keep it all in the family, but he does have a very large group. He has over 30 offices from Fresno down to San Diego and from the beach out to El Centro.
Yeah, so every week you...
Every week I get lots of eyes, and for varying reasons. Sometimes their wife dragged them in because they're starting to miss things in their peripheral vision. Sometimes they just want to look more awake. Sometimes people have been told them one too many times that they have bedroom eyes.
All right.
And they're sick and tired of hearing it.
Is it more women than men that you see?
You know, it's actually about half and half.
Okay.
I'm pretty surprised. Most of the time we think that women are more concerned about their appearance, and eyes are the very beginning of the appearance. It's your first impression. It's the thing that people look at when we're having conversation, and so it really decides, does that person have likable eyes? Are they sleepy? Are they interested in what I'm paying attention to?
You know, especially like in the workforce, you know, and I've looked at some of your photos, and we're gonna show these in a little while. But I was thinking, because I always think some of the doctors that come on my show are exaggerating, but when I looked at those photos, it's true. I mean, you took care of their eyes, and they look rested, or they look more dynamic.
Right. The biggest thing I get when they walk into my office, they say, I've got told too many times I have bedroom eyes, so here I am.
Is that like saggy eyelids, or what?
It took me a while to figure out what that means, but I think that means sleepy.
Okay. Okay.
Or tired, and they say, but I just want to look refreshed, but I don't want to look surprised.
Okay.
I hate that surprise look, and I do too. I agree. It should just be a rejuvenation of how your eyes looked when you weren't thinking about your eyes, when you didn't have to think about them.
So at the top of the show, I said that you could look years younger by just addressing the eyes. You believe that?
I do. Not only because the eyes are make your first impression, but also the eyes can be the door to everything else. I can do a facelift, essentially through a lower eyelid incision. I can do a brow lift through an upper eyelid incision. And so there's a lot that can be done just considering the small real estate, a lot can be done to improve the generalized facial appearance.
All right, now I know your age, and I've interviewed you on about mommy makeovers, and you look about 20 years younger than I know your age, about 20 years younger than you really are. So it's good to see that you walk, you talk, your skin looks good.
Well, I tell all my patients that this was bought with a price, and so and this is probably the one field where I'm very proud to age and get older, because I think some people are worried. They don't want they think that youth is inexperience.
Now, eyes in particular, though, you say can be life-changing.
Absolutely, and it was for me. I'm proud to.
Is that right?
I myself am a patient,
okay.
Randy, and I had my eyelids done, not because I felt like I looked tired or sleepy, but because I wasn't born with a crease in my eyelids. A lot of Asians don't have that, probably 70%.
And it bothered you?
East Asian. I did. It bothered me quite a bit. I think some of it was cultural. Growing up, that was something that was prized. And you know, you're told, oh, so and so has big round eyes. They look beautiful, and I think that it was a confidence issue, and I think it was the one thing that I felt like I wanted to change. And it's a very easy procedure, very straightforward. The recoveries, I had the surgery I think on a Thursday, and I was back to work on a Monday.
Is that right?
And it really changed my life.
What did it do?
It changed the way I put my makeup on, which sounds silly. But I used to fret over, my eyes were different shapes. I felt like I needed to use a lot of eyeliner and eyeshadow and eye makeup to make my eyes look bigger. And the more you put on them, the smaller they actually appear, paradoxically. And so now I feel like I have my routine. I can put on my makeup very quickly.
Did you feel prettier
I think
when
so.
it was all done?
I think so. I mean, I think it was a very subtle change, honestly. I mean, I think even my mother said, you know, with makeup on, it's about the same. But it was for me.
Okay.
This wasn't for myself, or I was married.
So it was a
by then.
boost. It was a boost in your self-esteem.
Absolutely.
You felt better about yourself.
Absolutely. I used to go to makeup counters. I never let anybody do my makeup because I thought, oh, they can't. I know how I have to have my eyes. I know I have to put 3 inches of eyeliner on.
So the Asian eye.
The Asian eye.
Because you do all types of eyes, but the Asian eye, are there a lot of Asians that are out there that can't stand their eyes? And if they can't stand their eyes, why aren't they doing something about it? Is it the fear of the downtime? What is it?
I think it is fear, but there's a fear of multiple things. Sure. There's a fear that I think the biggest fear is that it won't come out right, that it'll look weird. It'll look Asian eyes. The idea behind making this eyelid crease is not to make a Western eye. It's not to change the eye. It's really just to make that crease so that it appears slightly larger, but it's not to make a white person's eye on an Asian face. And I think sometimes
that's the perception.
That's the perception. And unfortunately, sometimes when it's not done correctly or with that in mind, it can look a little bit weird, like you put a Western eye on an Eastern face.
So let's move on to the aging eyes. Okay. What are the different categories of patients that you see?
So anatomically, from top to bottom, I mean, there's the upper and then there's the lower. Now, generally in your 40s, that's when you start to notice the darker circles and the bags that happen. And I think the old wives' tale is that you're not getting enough sleep. You're usually probably at the height of your career, or you're working towards it, and you're stressed. And I think it's a little bit of a myth that happens because of stress. I think it's a lot of genetics.
Why is it under the eyes seem to age first? What's going on? Why under the eye?
I think everything ages all together, but it's much more noticeable. There was a flat surface there before, a smooth surface there before, and now there's little lines. There's crepey lines, or
is the skin thinner under the eyes?
The skin is absolutely thinner. It's the thinnest skin that you have anywhere in your body.
Okay.
And so when the fat starts to pooch out, it's very noticeable. And when the sun damage that happens from years of running around on the beach without sunscreen, and those crow's feet, and the crow's feet can extend down into your cheek area from years of smiling, those lines show first.
So when a woman comes in, or a man comes in on the consult, what do they say?
They say that their eye cream's not working. They say that they've gone to the store and they've tried every single thing under the sun to tighten up this area, and it just won't tighten. They've tried Botox in their crow's feet, and it sort of works, sort of doesn't, but it doesn't address the lines on the sides of their face.
Okay.
And they say that they're getting passed up for promotions because their boss doesn't think they're already stressed to the max because they've got all these dark circles under their eyes, or these big bags under their eyes, and they're looking tired, and they feel like, I'm sleeping, I'm getting a good night's sleep, I'm very well rested, I'm at the top of my game, and yet I'm being perceived as tired and exhausted and stressed.
So what do you do?
So it depends on what they need. I do what needs to be done.
All right.
So if they need a little excess skin that has gotten droopier to be taken out, we take out that excess skin. If they just need the fat taken out, that can be done scarlessly from behind the eyelid.
Like for the big bags?
For the big bags.
All right.
Now, if it's really big, a lot of times it stretches the skin and we need to do the skin. You can actually do a facelift, a mid-facelift from eyelid incisions. It's right there. And actually, a lot of times, that's the only way to get the smile lines on the side of your face out. A facelift
so how
from the
are
bottom,
you getting rid of the crow's feet, though?
The crow's feet are straight out from here.
Okay.
Those can actually be Botoxed.
Right.
The ones underneath here, that's actually a mid-facelift, which actually can be done from the same incision that you do the lower eyelids.
Okay. So surgically, what do you do then for under the eyes?
So it sort of depends on what they need. But the most common is I make what's called a subciliary incision. So that's right under the little hairs of your eyelashes. And I don't cut any eyelashes, but this scar is almost imperceptible. It is imperceptible once it's all healed up. And we make a skin and muscle pocket flap, and I trim out the fat. We can do almost a mid-face lift from that area.
Okay.
So then it's not just a pull like a facelift. Now, I'm not dependent on the skin to actually rejuvenate the eyes and then I can actually take out more skin.
So what about fillers under the eyes, for hollows under the eyes?
So it has to be done very carefully. I've seen too many people get filled and they just look like cherubs. And the absence of, as you said, the absence of wrinkles is not youth. It looks ridiculous. It looks odd, and it looks like it's been overfilled.
I mean, there are people, yes, that are overfilled. You spot them
from a mile away.
Yeah.
And it actually makes your eyes look smaller, I think. I think when you've got so much filler here, it just pushes up, and they get the kind of beady-eyed look, which I think is a much worse look.
So people are being overfilled.
Overfilled. Using wrinkles here should not get filled with filler, except for very, very subtly. And even in the hollows, in your tear trough, it's got to be done extremely carefully and delicately. There's a ton of blood vasculature to your eye. Any little poke can cause a bruise in that raccoon eye for quite a long time. A bruise in that area takes a long time to resolve. That's weeks of concealer. And not to mention, the most dreaded complication would be to embolize one of these veins and cause blindness.
Okay. So under the eyes. Okay, so to take care of bags under the eyes, you prefer to do what? Is it a combination of procedures?
It is a combination of procedures. I mostly like to operate. I think that for the most part, the knife is the most predictable. There are people, it's out there. People are doing peels, they're doing lasers to under eyelid skin, and I don't think it's bad, but I think it's very difficult to control. There's you have no idea
so
how.
that crepey skin underneath. Mm-hmm. What are you doing? You're like moving it up?
We're moving it up and trimming it out.
So you're trimming it out.
And
moving it up.
And we are,
nice.
What we're doing is taking kind of this fat pad that a lot of people have that have drooped. A lot of times people end up with a shelf right over here on their cheek. And what they try to do is just rely on skin. If you rely on skin just to pull it up, you'll either look, like odd and slanted-eyed, or actually what'll happen is the skin will win and gravity will win, and you end up with an actual functional problem. But if you just redrape the skin over when we take the SMAS, or if we take the fibrous tissue underneath, like we do in a facelift, and tack it up, and then just redrape the skin to get the wrinkles out. It's a very natural look. It's beautiful. Much more often than you would think. I think most people, when they come in, they say, I just want my eyes to look not as tired, and then we're talking about a facelift through their lower eyelids, and they're like, whoa, hold on.
Yeah. So, but I mean, what we're talking about, what you just said right there, like removing the skin, I mean, it's something you do routinely? You do every week?
Yes.
And is there a big learning curve for this?
I think so, because the skin is so delicate. It's really like a seesaw. You're robbing from Peter to pay Paul. And I think if you take too much skin, if you rely too much on the skin, you can end up with the lower lid malposition. And your eyes are mechanically designed to be absolutely perfect. For the tear ducts to work, for your blink reflex to work, for you to be able to open and close your eyes. It's all a very, very delicate balance, and you can't get terribly aggressive.
Okay. One of the things at the top of the show, we're here with board-certified plastic surgeon, Dr. Lily Lee, and you do more of these procedures in a week, like 15 of these eye surgery procedures a week. And I have friends that are plastic surgeons that have been on my show, and that's more than most of them do in 6 months or in a year, oftentimes. What's the learning curve like? And I asked you that, but I mean, are you that much better now, 100 of these later, 200 of these later, or hundreds of these later?
I mean, I'm very meticulous about taking photos of my patients, and then I go back routinely to look at them. And people like to look at their own pre- and post-op photos, because I think sometimes you forget what you used to look like before, after surgery. Because the idea is to restore your look to a very natural look. And so people, I think, forget what they used to look like.
So over the eye, what are you doing?
So the most simple procedure is to take out the skin. And that is the most commonly sought after procedure.
What do you call that procedure?
Just blepharoplasty.
Okay.
So bleph is the upper eyelid, plasty is moving the skin around or making it the form better.
All right.
And nipping that out is very straightforward, but under the eye, underneath the skin, is where all the magic happens. There's muscle, there's several layers of muscles that are responsible for opening the eye, closing the eye, and it all happens in a very delicate balance. Underneath that, then there's the fat, and there's multiple pouches of fat behind everybody's eye that can also be trimmed, and not trimmed to the point that they look cadaveric or they look like a skeleton, but just trimmed so that the eye appears wider.
Because you can't overdo it, right?
Absolutely.
Because you see these skeletal kind of...
Right.
Was that the surgeon's error, in your opinion? Could it have been the healing process?
No, I believe it's surgeon error. I think it's a lack of seeing what, or it's an over trim. In the right candidate, just a small slip of skin over the upper eyelids, taking that out can make their appearance dramatically different.
Like 5 years younger?
10 years.
Okay.
It makes them look rested, and a lot of times it's very subtle. These people come back from surgery and they say, and patients will tell me that coworkers will say, "Oh, you look like you got a really great night's rest," and that's the goal. The goal is just to make them look rested and rejuvenated, and it's a subtle change. It's not looking shocked and surprised like this patient right here.
Okay.
You can see the very heavy, weighted eyelid, almost looks closed, and just a small slip of skin coming out in a very routine outpatient procedure with a short recovery time can really change the look of her eye.
How short is the recovery on something like this?
It's
in
not,
a perfect world, I mean, if everything works out.
It's not uncommon for me to operate on a Friday and for the patients to go back to work on a Monday.
Okay.
So they'll be a little bit swollen, a little bit bruised, but you can certainly wear clean mineral makeup on top.
All right.
Now, this is another patient who they complained that he couldn't see anything, that he never saw. They would show him things and he would miss everything in the peripheral vision, and he just couldn't get his eyes open quite enough. So on top of removing the excess skin over the top of your eyelids can actually be opened up. We can strengthen or reattach the muscle that's responsible for opening your eyes.
Interesting.
So that it works mechanically more efficiently.
Okay.
So this is a man who was dragged in by his wife. His wife was a former patient of mine, and she said, "Oh, you've got to do my husband, and you got to convince him." And he came in grumpily, and he said, "I don't know what I'm doing here. Plastic surgery is for women."
Okay.
And his wife said, "He can't even see the side of the road. We'll be." And his complaint was her backseat driving has gotten worse and worse every year because she would say, "Oh, look at that," or "Careful this," and he wouldn't see it.
Interesting.
And so this is not only just a rejuvenation, a cosmetic rejuvenation, but this is also a very functional procedure.
So the peripheral vision seems to go first?
The peripheral vision, because the top of the eyelid, it droops from the side down.
Okay. Now, because you do a lot of eyes, we've talked about this. Is there anything that drives you crazy or frustrates you with what's going on across the country when addressing the eyes? Is there?
So I think there can be an overlift of the brows.
Okay.
And while I think that there are some people who are good candidates for a brow lift, what people are most scared about when they come to my office is I don't want to look surprised, because they've all seen people with brows hung up halfway up their forehead.
Yeah, forehead, yeah.
And they look shocked, and they're not.
That's not youth, obviously.
So,
high brows.
Exactly, Randy. That's not youth. Just similarly as...
18-year-old women
don't walk around looking like
don't
this.
have high brows.
Right.
So why is it going on? So high brows. Is it in the surgeon's hand? Is the patient wanting it? What is it? What's your take on this?
I don't know.
I know you want to be
positive. I've thought about it myself. I can't explain it. I think some of it is that there is a relapse rate of droopy brows, and so we tend to overdo it with the thought that it should come up.
So back to this guy right here. He looks younger. A lot better.
He looks great.
So what do they say when it's all over? Because his wife, you said, drug him in.
Now he comes in by himself.
Okay.
He's thrilled. He says, "I don't need my backseat driver anymore because I can see."
All right.
And he feels great. He said he doesn't look surprised, which was a big concern for him. He doesn't look, and he can see. And he says, "This is what I looked like when I had young kids," and now he's got young grandkids.
So with the brows, by the way, like when is it a brow problem and when is it just the skin?
There are very distinct landmarks for where your brow should be. Your brow, if you feel the bone right here, your eyebrow should really sit just above or right on the eyebrow bone. essentially.
Okay,
That's
okay.
where it's supposed to be. If it's lower than that, then maybe you need a brow lift. Certainly, if it's right there or above, you don't need to lift it any higher.
So you do kind of an endoscopic brow lift?
I can. There's numerous ways. There's a bunch of different ways, and we try to customize it to the patient. Sometimes, if their hairline is already very high, you can't do you can't do a direct incision, or you can't do one in the hairline, because then if you pull it up, their forehead's even more is even higher. So it really just depends on what their face looks like, what they're trying to achieve, and how much downtime they're willing to take.
Do you think the eyes make the biggest difference
I do.
in the appearance, in the youthful look?
Absolutely. It makes the first impression. It is the window to the rest of your face and the rest of you.
So do you think the eyes, of all the different plastic surgery procedures, that the eyes can make the biggest difference?
Absolutely.
Okay.
The eyes are the window to the rest of your face. They make the first impression. That's what everybody looks at. They're right in the middle of your head. And that's what everybody looks at. And I have so many women, it's changed everything. It changes their makeup. Suddenly they can wear makeup and they don't have to worry about it being smeared all over the place because the wrinkles aren't there anymore, or because that flap of skin is not sitting right on top, smudging it. They feel more confident, they feel better. They know that the photo they take is who they look at in the mirror in the morning when they leave.
Okay, good, good. Now with more photos, because we have a few more minutes.
Let me show you another patient.
Okay.
She actually came in for her breast. She had huge lower eyelid bags. And during the consultation, I said, you know, we can make your breasts larger and we can make your breast what you've dreamed of. But what I'd really like to do for you is clean up the lower eyelid bags. And she just said, you know, I never knew that could happen. And so she told her work that she was taking a week of vacation and she didn't tell anybody that she was having breast or eyelid surgery.
Okay.
She really wanted to keep it a secret. And she said she went on vacation, she came back to work, and she said, everybody, where did you go? You look great. And she said, they weren't looking at my breasts, because she said, I'm fully clothed at work, and really the change down below is very subtle and covered by clothes. But what they were looking at were my eyes, and she said, I was so happy. She said nobody ever said to her, wow, you look really rested. They always said, gosh, you look so stressed.
Wow.
You must have a lot going on because you're not sleeping, because you've got dark circles and you've got big heavy bags over your eyes.
So do you see a lot of people, because of what you do, women 40s, 50s, that you go, boy, I could help these people?
I do. I sort of have to resist the urge when I'm out and about to say, I can fix that. But it does have to ultimately be a personal choice. It does have to be something that they understand, first of all, education, that they understand that something can be done, and it can be done very naturally without a surprised or weird look to them. And it can be done very easily and affordably with very little downtime. And at very little cost.
So with more and more like day spas or lasers out there, do you think, and they're saying you don't need surgery. I mean, the word on the street is, and I don't know who to believe sometimes, right? They say, Randy, you don't need surgery. You don't need, not me personally, but they'll say, you know, with minimally invasive, non-invasive, and laser, you don't need eye surgery. What is your response to that?
I think surgery is the most consistent thing and the most reliable thing. I think
For the eyes.
For the eyes. For a lot of places, but for the eyes specifically.
Okay.
I think it's such a delicate balance. Your eyes are specifically, they're a very sensitive area, and I think they are created to be in a very delicate balance. The opening eye muscles and the closing eye muscles have to be in balance. Your lids have to be opposed to the globe in a very delicate balance for your tear ducts to work. And I think to mess with it with laser, which oftentimes can have just as much downtime because you're resurfacing the skin,
Okay.
If not more than surgery. When we do facelifts, a lot of times we'll combine it with a peel or a laser, and everybody says, oh, the facelift was nothing, but that peel or that laser, that really
So like a
made
tummy
it.
tuck, I mean, you've been on the show talking about mommy makeovers before, and so you remove that stretch mark skin.
Right.
Okay. So for crepey skin, those little fine lines of wrinkles that I guess no
amount
cream
of
is
Botox
working,
will
okay.
work, yes.
You're kind of cutting it out and draping it or bringing up the skin in the where? At the bottom
Right.
of like
right
where the
along,
eyelashes?
right along where your eyelashes are.
Now is that skin, because you're bringing it up, is that less likely to wrinkle in the future? Is it thicker skin?
It's
Because it's not.
That's a
my
very good question. You know, you're not bringing up that much skin, and more of the skin that you're bringing up is actually up here. Now, what is more important, just like a facelift, we're not relying on the skin we're just redraping the skin. More of the work is done underneath. The structure of the fatty tissue layer that's right up against the bone, if we tack that up against the bone, so back to where it used to be before it droops down, and separate it from the skin, then you can just redrape the skin without the wrinkles.
And coming on a Friday, and back to work on Monday, and they say, what happened to your crepey skin under your eyes? It's gone. And then they have to say that
That's their secret.
It's their new cream. Right? Because they don't want to tell anybody they had it done. Is this the kind of thing where people usually don't give you referrals because it's a private thing?
Very much. Very much. Everybody wants to go on vacation and come back looking really natural and refreshed as their alibi for surgery. And so oftentimes I do have trouble getting patients to say, okay, go ahead and put my photos on your website or advertise with what I've got, because I think people like to keep it as their dirty little secret.
Now we are out of time. So these procedures, like typical, like for example, the lower blepharoplasty, is that what it's called?
That's right.
Okay. How long does that take you to do?
About 30 minutes.
30 minutes. Because we talked on the phone, and I always tell doctors, if I could just get you guys to tell the truth on my show, like what you told me on the phone. But you said that even though lasers work, I guess we agree on that it could take 3 or 4 laser treatments to hit that area, whereas something you can do and just get rid of that skin in
my scalpel
20
cuts
minutes.
through 3 cells when I bring it across, and that laser destroys very indiscriminately over a surface area that's set by a computer.
Okay.
And yes, when these lasers are done 3-4 times, a lot of times the cost, if you add it all up, costs way more than the cost of my facility fee and my professional fee, and even in the anesthesia.
Okay, good. So come in, get evaluated. I guess that's the key, go in for a consult. So if you don't like the way your eyes are aging, what do you say to the person watching this? Come
in for a free consultation. Let me show you what I can do. Let me tell you what can be done, and then you decide.
All right, and the men? Men are coming in for this.
Men, absolutely. Absolutely. The results are so subtle, nobody's going to know that you ever saw a cosmetic plastic surgeon. You'll look like you got a great night's sleep.
Good. I want to thank you for coming on the show. Very interesting.
Thank you, Randy.
Thanks again. You've been watching The Wellness Hour. I'm Randy Alvarez. If you'd like to see this interview again online, go to our website and put in Dr. Lee. For now, I wish you could help. Hi, I'm Randy Alvarez, host of The Wellness Hour. We are currently looking for licensed health practitioners to be on the show. So if you have something to say, a great message, a new breakthrough, you have to let us know about it. Visit wellnesshour.com, click on how to become a guest, or just email me directly at randy@wellnesshour.com. If you know a doctor that you think would be great on the program, send them my way. We'll see you here.